Let's go to Gaza City and say hello to Yousra Abu Sharekh, who is the Gaza Program Coordinator for INARA. It's the International Network for Aid, Relief and Assistance. Thank you so much indeed for your time, Yousra. You are Gazan yourself, so presumably you haven't left the enclave for, well, since the war in Gaza began. Is that right?
Yes, that's right.
How are you managing?
Actually, the situation here in Gaza Strip is not conditionally by having the ceasefire on the ground. There is no more suffering. The opposite is happening right now in Gaza Strip. People are extremely drained, exhausted, and they are suffering and don't have any access to any of their basic needs. Even with confirming that there is no famine, but the impact of famine that started in July 2025 is still on the ground. Babies have malnutrition and children as well. People don't have any access to not only the food, but also the dietary and variety of food. It's about like fresh produce. What is only allowed to enter in Gaza is the processed food with high portion of salts and sugar, which is not healthy for bodies, especially after months of having nothing to eat. On top of that, it's not about the food availability, it's about the deliberate destruction of the system. People don't have any sheltering, proper sheltering during this weather, harsh weather. During the storms and the winds and the very harsh conditions. Also, they don't have any access to health. For example, my son last week got injured by a pen in the street from the destructed and destroyed streets, and we didn't find any tetanus shots to have for him. So imagine the situation for more serious issues and diseases here on the ground in Gaza Strip. Sometimes people die from famine, sometimes another phase, children die from bombardment, and now they are dying from cold and storms. So no one guarantees that the situation here on the ground is getting better, especially with all these constraints and challenges on the aids entering Gaza Strip. Winter clothes are lining up outside Gaza Strip, while children here in Gaza don't have any warm clothes to wear during the very harsh conditions. So we are talking about more and more deteriorated situation. People are still in need for everything, and their need is getting huge and more because they are getting more vulnerable during after almost 2 years in a row from the conflict here in Gaza Strip.
You are talking about clothes for children, winter clothes, Yousra. UNICEF, the UN Children's Agency, says it's been able to distribute 250,000 kits of winter clothing for children. And then UNICEF says there are more than 1 million children in Gaza, so clearly it's not enough. How does INARA work? Do you try to bring your own aid in, or do you get the aid that the United Nations is distributing, and then you target particular families and people? How does that process work?
Actually, UNICEF is entering and allowing some clothes to enter, but it's not enough, as you've said. For INARA, we have trucks load of clothes, winter clothes and warm clothes for children, and still we are not able to bring them inside Gaza Strip to be distributed to the most in need. So we are at INARA focusing on what we could provide, like MHBSS, mental health and psychosocial support for children to alleviate the suffering and to eliminate and avoid the impact of the very hard conditions that the children here in Gaza are going through. Also, we are focusing on educational activities to ensure that after 2 years of losing the academic life for children, we will support them to return to kind of normalcy, for them to have this access to educational activities. So it's about like all organizations here, because they are challenged and the registration process is taking a very long time. So we are doing our best and trying our best to support in any way we could. Not necessarily if we cannot provide something to people in need, at least we can help them, hear them, support them mentally and psychosocially.
Yousra, how is this having a mental effect on Gaza's population, however old or however young they are? Doctors have told us that if a patient requires an amputation, it's not one operation. It could possibly be 20 operations over the course of a few years. Doctors have told us that when a person is malnourished, it's not just a question of putting food in their hand or in their mouth. You need to be very careful about how you progress with the medical treatment of someone who's been suffering from famine and starvation. In other words, people are vulnerable, people need to be taken care of, but they see that the other side, Israel, is deliberately denying them life-saving supplies. What kind of mental toll does that take on a person?
Actually, we, for example, at INARA, we have our healthcare services clinic that provide primary healthcare services here in Gaza City. However, many cases, due to the huge destruction in the streets, due to the absence of assistive devices, for example, if the case has amputation or for any physical reason they cannot move, so they don't have access to this. So that's why we at INARA now focus more on mobile medical team, because the northern part of Gaza Strip has no hospital at all. After the huge destruction of infrastructure there in North Gaza. So it's not about the health conditions only, but it adds more layers of mental burden, because this case, for example, will be always worried how to secure or to access the very basic of health services like physiotherapy, for example. Another example is the non-communicable disease patients like hypertension or other kind of disease. They are like deeply suffering from accessing their routine medicine, and we can see it and we can hear about it, and we are so challenged to do something for those in need, and they are vulnerable. So as you said, it's not a one step of intervention. It's a complex of and multi-sectorial interventions as well. So families now, for example, during the winter, they are sheltering in partially damaged houses because they don't have any other options, and they are not allowed to go to their areas in after the yellow line. So those families choose to stay at risk and to increase the risk on their lives, especially during the storm and the heavy rain, rather than to live in the street, for example. And this is the case for many families in Gaza. So, and it's not only about this, it's about malnutrition, cold. Babies are being died of cold. And we feel at the point, we feel like our children's lives in Gaza are at sale. So it's not fair for anyone in Gaza, children, parents, adults, to go through all these multi-layered suffering issues.
Yousra Abu Sharekh, thank you so much indeed for joining us, Yousra.